Hello, and welcome to another edition of In Medicare News. We've got another update that we're going to be doing here about everything that's going on with COVID-19. Today is April 6, 2020. Everything I say is going to be accurate as of today. This one's going to be kind of a sequel to the last video that I just did, which was a update showing the very first of the emergency measures that was issued by the Ohio Department of Insurance. There's been several other ones that have been issued by the Department of Insurance and one by the Department of West Virginia that I'm going to touch upon. All of these are pretty much something that's relevant to people of the Medicare population. Be sure to check out our website. If we've got other updates, we're going to try to get them on there to you, as well as our Facebook page, also our YouTube channel. Please subscribe to that. There's a little bit of commentary going on the Facebook page right now. There seems to be some people making jokes of it. I guess, we're going to leave that up there. We're not going to try to moderate that since the comments seem to be fairly respectful or at least non-derogatory. I'm not sure how much humor I see in this situation right now, but that's just me. So feel free to check out our site. Also check out the Ohio Department of Senior Health Information Services. It's OSHIP. OSHIIP, Ohio Senior Health Insurance Information Protection Service, OSHIP. It's part of the State of Ohio website, and it'll give you some of the latest information as well regarding what's going on with insurance in the state of Ohio right now. But just to recap, the very first bulletin that came out from the Ohio Department of Insurance, which I will refer you to the previous video for more information on, is to ensure consumer accessibility to healthcare services to test and treat the virus. That is Bulletin 2020-02, access to coverage for Ohioans impacted by the COVID-19 virus. Just to briefly summarize a couple of the things I touched on in the last video. Issuers of travel insurance, that's insurance companies who offer travel insurance, are reminded that unless a specific exclusion applicable to COVID-19 applies, the travel insurance policy that covers sickness, accident, disability, or death occurring during travel must cover such risks related to the COVID-19 according to the terms of the policy. The only other thing that I want to remind you of from that bulletin is under the telemedicine section. Issuers are prohibited from excluding coverage for a service that is otherwise covered under the health plan solely because it is delivered as a telemedicine service. That means that if something is provided when you see a doctor in person, under this rule, it must continue to be covered as a telemedicine service, at least during the time that this is going on. Remember, this is issued by the Ohio Department of Insurance, not the Department of Health or the Centers for Medicare Medicaid Service. So this is specific to the state of Ohio. If you are not in Ohio, check with your state's Department of Insurance or ask your local insurance agent. I'm sure they know. So that's the first bulletin. There was a lot more to it, but we went over it in a previous video, so check that out. The next one that I want to bring to your attention is Bulletin 2020/03, Health Insurance Coverage Flexibility for Ohio Employees. Now, we normally don't deal with insurance through employers because they have their own people that they deal with. So this is just kind of a service that we're providing. There's more to this bulletin than I'm mentioning here. However, the part that I did want to bring to your attention: insurers must permit employers to continue covering employees under group policies even if the employee would otherwise become ineligible due to a decrease in hours worked per week. Insurers are required to permit employers to continue providing coverage to employees under group policies regardless of any actively at work or similar eligibility requirements in the policy. Additionally, insurers are prohibited from increasing premium rates based on a group's decreased enrollment or participation due to COVID-19. This is during the state of emergency, for as long as this is being declared in the state of Ohio. What this means is that insurance companies cannot require you be dropped from your health insurance plan due to either decreased work hours or being laid off during this period. Now, that doesn't mean that that won't happen, but it means that the insurance company is not to blame for this. If an employer is going to drop you from this coverage during this time or eliminate your health insurance coverage during this time due to a decrease in work hours, because of the state of emergency, that is something the employer is doing. The insurance company is being ordered to continue this coverage during the duration of this emergency. If you want to look it up, that is Bulletin 2020-03 for the state of Ohio. So it is not the insurance company that is knocking you out. Additionally, special enrollment employees who lose coverage are eligible for a special enrollment period to enroll in new coverage. Premium subsidy in the state of Ohio, that means you go on to healthcare.gov, you apply, you are being given a special enrollment period. Premium subsidies may be available for those that qualify by purchasing plans on the Federal Exchange. Plans sold on the Federal Exchange are effective the first day of the next month after enrollment. For those purchasing policies sold outside of the Federal Exchange, insurers shall waive normal special enrollment procedures and allow applicants to obtain coverage effective the day after their loss of employment. This is outside my area of expertise, but basically if you're not going on the health insurance exchange and are purchasing major medical coverage through private purchasing alternatives, it's going to be effective the very day after you lose coverage from your employment, and normal special enrollment procedures are being waived, and you basically just go on. I guess contact an insurance advisor who understands more of that situation and deal with that. But basically, if you lose health insurance coverage, there are opportunities for you to get replacement health insurance coverage while this is going on. So that is the remainder of Bulletin 2020-03. The next one I want to go over is Bulletin 2020-05, COVID-19 testing and treatment, out-of-network coverage. And there's 2 points to this I want to bring to your attention. During the course of this emergency, insurance companies are being ordered. Emergency medical conditions under Ohio law include testing and treatment related to the COVID-19 virus. These emergency services must be provided without pre-authorization and must be covered at the same cost-sharing level as if provided in-network. COVID-19 testing and treatment are necessarily emergency services because symptoms of COVID-19 would result in a prudent layperson with an average knowledge of health and medicine to reasonably expect the lack of medical attention to result in serious harm. So insurance companies are being ordered to provide COVID-19 testing and treatment in and out of network and at the same cost sharing level as if it were provided in network. Just part of the second part of the order here I want to mention. Additionally, health insuring corporations providing coverage in Ohio must ensure coverage for out-of-network emergency services without balance billing. So if you are going out of network for an emergency service during the course of this emergency, during the course of this state of emergency, there cannot be balance billing added to this. That's pretty much all I want to mention to this. If you're on Medicare, which is my business, then that's not usually an option or something we need to worry about, but just something I wanted to give you an update on. Let's see, the next one is Bulletin 2020-07. This isn't directly related to medical or Medicare, but this is related to long-term care insurance, which is peripheral to to our business. So I just kind of wanted to mention this as a service. Part of Bulletin 2020-07. The superintendent hereby orders insurers to provide at least a 60-day grace period as to any policy provision that imposes a time limit on an insured or claimant to perform any act, including the submission of information or funds with respect to a contract for insurance. This means insurers are to extend such time limits by at least 60 days from the last day allowed under the terms of the contract. What that means is during this period, if you are having issues or trouble paying your long-term care insurance policy premium, if you have a long-term care policy and you are having trouble paying it, the insurance companies are to extend the grace period for paying your premium beyond the normal 30-day grace period up to an additional 60 days beyond that. So you'll have 90 days from, really from now, but I mean it can go longer if the state of the emergency lasts even longer than that, to pay your premium. Now that doesn't mean that you've got a couple of months free. You will be expected to pay catch-up premiums as well when this is over. So if this lasts 3 months and you haven't paid 3 months worth of premiums, you will be expected to pay 3 months worth of premiums to catch up, but you are not in danger of losing your long-term care insurance while this is going on. Lastly, the only thing I want to bring up, and this one just kind of struck me as a little bit funny, because this can't happen in the state of Ohio. This can't happen legally in the state of Ohio. I've actually been told of circumstances where this is happening. But this has to do with door-to-door solicitation, door knocking. In the state of Ohio, if you are a Medicare eligible individual, in other words, you're 65 or over, you can't be door knocked for the purposes of selling Medicare related insurance. There's actually a law in the Ohio Revised Code that specifically states that. And if you're in most other states, that's allowed for the purpose of selling Medicare supplement insurance, although it's not allowed in any state for the purpose of selling Medicare Advantage or prescription drug plans. It is an actual CMS guideline. However, in the state of West Virginia, door-to-door solicitation is allowed for, at least on the Medicare side, the purchase of Medicare supplement insurance as well as other kinds of insurance. The state of West Virginia just issued a rule. It is Emergency Proceeding 20-EO-06, which says, I have to find it here, individuals engaged in the business of insurance in West Virginia may leave their residences to provide any services or perform any work necessary to operate or maintain essential business or operations of insurance entities, provided that insurance institutions, including companies, underwriters, agents, brokers, and related insurance claims and agency services, their employees or representatives, are prohibited from engaging in door-to-door / in-home solicitation of new insurance business or other door-to-door / in-home insurance activity or transactions during this insurance emergency. Unless, of course, you're either servicing or conducting another essential transaction regarding a current policy, you are engaging in a essential transaction. You're engaging in an activity at the request of the policyholder. It is essential and cannot be completed electronically or otherwise remotely. And you're using some sort of appropriate social distancing techniques or tools. Yeah, so nobody should be coming to your door. If they're selling a Medicare product and it's not a Medicare supplement, they shouldn't be coming to your door anyway. But if you're listening to this in the state of West Virginia, you can still be door-to-door solicited for some kinds of insurance, but while this emergency is going on, you cannot be. That's just, one of those things that gets me. Door-to-door solicitation kind of annoys me anyway, so I'm not very happy when I hear that my clients are door-to-door solicited, and I especially don't want to see it here. All right, so that's it. We will have links to this put up on the low bar to this video. If you got any questions, feel free to give a call, shoot us an email, send us a direct message on Facebook. Doesn't matter which. Feel free to contribute to comments. I'm happy to have some. I'd appreciate it if they were less humorous, but or at least people are taking this a little bit more seriously. We're taking this very seriously. However, anything else, feel free, give us a question, and yeah, we will see you next time.